Hello everyone, it's Dr. Harsha Popli, MDS in Preventive and Pediatric Dentistry and a proud member of Odont Academy of Learning. Today I am in front of you and I will be talking about Down syndrome and its dental consideration. So let's begin the session. These are the contents. First is introduction, epidemiology, etiology, types of Down syndrome, extraoral features, intraoral features, dental consideration for Down syndrome. So I will be covering on this following headings. So let's start with the introduction. Down syndrome, it is a congenital disorder and which is the most common intellectual disability found nowadays. It is stemming from the chromosomal abnormality. In this, there is a lifelong intellectual disability, developmental delays, and other problems. It is the most common genetic cause of learning disabilities in children. Down syndrome affects of all the ages, races, economic levels. It appears in 1 in every 800 births. Coming to its etiology, this syndrome occurs when one chromosome has an extra part or an error occurs in cell division or an extra chromosome exists resulting in 47 chromosomes. So basically we are born with the 23 pairs of chromosomes. So which means it's total of 46. But when the body produces an extra chromosome or the extra genetic material, so it alters the type of the body and its action. So here you can see at the chromosome 21, it is having a third chromosome. So with this, it is also called as trisomy 21. So there are around 3 types of Down syndrome: trisomy 21, translocation, and mosaic. The most commonly found type is trisomy 21. Trisomy 21 contributes for 95% of its rate. In this, there are 3 chromosomes in every cell. This form of Down syndrome, it is caused by abnormal cell division during the development of the sperm or the egg cell. Coming to translocation, name itself says there is a location disturbance, means there is an extra part of chromosome which attaches to the another chromosome in every cell. So the rate is of translocation is 3 to 5%, which is the second most common. Mosaic is 1 to 2%. In this, there is a mixture of cells. Some chromosomes there will be 2, some will be 3. So it's a mixture pattern. So once again, we repeat the types of Down syndrome, that is trisomy 21, translocation, and mosaic. Trisomy 21, it is almost 95% and the most common type of Down syndrome. Down syndrome is also called as trisomy 21. So let's talk about its risk factors. What causes the Down syndrome basically? So the first factor is advancing maternal age. So as the eggs of the woman get mature or older, with the age, there is a risk for the improper chromosome division. So by the age of 35, the risk advanced like 1 in 400. At the age of 45 years, there is a risk is 1 in every 35 birth. You can see the Down syndromic patient. Also, if the patient had a child, the first child is having Down syndrome, so there is 1% chance that a mother can deliver the second child with Down syndrome. So Down syndrome patient, they have some patent features to identify them. So let's talk about some extraoral features, which is most commonly seen in every Down syndromic patient. So the first thing which you can see, Down syndromic patients, they have a flattened face and a broad face. So here you can see the nasal bridge is flat. You can see the eyes, it is almost like a almond shaped eyes, and also they have a one patent sign on their palm, that is a semen line. This is the semen line. This is a normal hand. Here you can see there are 2 lines. But in the Down syndrome patient, if you can see, there will be just one single stretched line, which is called a semen line. Also, their head size will be small at the birth. There will be abnormal ears. Short and broad hands can be seen. There is a white spot on the colored part of eye which is called as brush field spot. The other feature we can see is the distance between the first and the second toe is very high, like the distance is too much. Also here, if you see, there is a open mouth posture. So these are the extraoral features which we can see and identify the patient as in Down syndrome case. Let's talk about the intraoral features, which is very important for our dentistry. So, in Down syndrome patient, it is little shocking that they are at the lower risk of dental caries. But as compared to cerebral palsy patients, they are at the higher risk of having a dental caries. So, Down syndrome is having low risk of dental caries, and that could be the reason because of good cleansing action of the saliva. But in Down syndrome, there is one risk factor of periodontal disease, and that is very high. This is due to their lower immunity power. Because of they having the low immunity, they are more prone for periodontal diseases. The third is macroglossia. Macroglossia is a term of enlarged tongue or a big tongue. The size of tongue is big and which covers the whole mouth, and the position of tongue disturbs the eruption of teeth. It disturbs the breathing pattern. So the patient can have a sleep apnea problem. Also, because of macroglossia, there is a delayed eruption. There is the posture, as I told, that the open mouth posture is visible, and also it can hamper the level of oxygen intake also. So the fourth point is malocclusion and low muscle tone. So the patient with the Down syndrome, they are commonly the patient of orthodontic treatments because, as I told, because of macroglossia and also due to delayed eruption and their size. This is like the Down syndrome patient have microdontia because of small size. So there is a disturbance pattern of eruption, disturbance pattern of size of tooth. So they are the patient of orthodontic treatment. And due to low muscle tone, their jaw development is slow. Also, we can see in Down syndrome is fissured tongue, hypodontia, and microdontia. Let's talk about some medical features with dental implication. So the most commonly seen is congenital heart disease, which is for 40% of Down syndrome patients can have congenital heart disease. So before we start the patient of Down syndrome for the dental treatment, we need to take a deep history or medical history, and we need to confirm with the parents whether the patient is having any heart issue. If they say yes, then you have to take a consent from the physician, and also you need to regulate for the antibiotic prophylaxis before the treatment. And the second most common is Down syndrome patient, they are 10 times more prone for leukemia. So again, we need to take a deep history, and if the patient is having leukemia, you need a consent and a blood test reports done. So with this, two other features or the other medical problem which we can see is mental retardation. Mental retardation is commonly seen, as I told, they are the most common intellectual disabled condition. So if normally there is IQ level of 90 to 100, but in Down syndrome, if the level is below 70, the IQ level is below 70, they are considered into mental retardation. So most commonly the IQ level in Down syndrome is found almost 50. Also, they have hearing problem. Speech problem is again the issue. As I told you, macroglossia, improper placement of the tongue is causing many other problems too. Sleep apnea is also found in many of the cases. So what we should do for the Down syndrome on aspect of dental treatment. So the first key is to prevent the condition. So as they are already the medical condition, so we need to give a fluoride application, increase the tooth resistance, optimizing the oral hygiene methods like tooth flossing, ask the parent to start using the battery operated toothbrush, as sometimes it is difficult to do the toothbrushing for such cases. So we need to motivate them for maintaining good oral hygiene so that we can save from the periodontal diseases. Some dietary modifications we have to make. We need to ask them to lower the sugar content and the carbohydrate content. And as the patient, they have orthodontic problems too, so the treatment protocols will vary with the cases. So some takeaway important point is that Down syndrome is the most common genetic disorder and it is the most common intellectual disorder disability. So this question they have asked, the most common intellectual disability is, so the option will be there and the answer will be Down syndrome. Their IQ level is 50 and it is also called as trisomy 21. Extraoral feature is like flat nasal bridge, ear will be small, head size will be small, hands will be broad and small. With the patent seminal line, you can see there the distance between the first toe and the second toe is too much. Intraoral features, if we talk about, so they are at a higher risk of periodontal disease. Risk of caries is less, malocclusion is severe, development of jaw is slow, delayed eruption, hypodontia, microdontia, crossbite, bruxism. These all are the common findings which we can see. Also important point to be noted is they are more prone for congenital heart disease and also 10 times more prone for the leukemia. So before we start for the dental treatment in Down syndrome, we need a deep medical history recorded. So here I end my presentation. Thank you for listening me.